two DHSC reports on the Tynwald Order paper. The first of those is the first annual report on healthcare transformation. This is following the Sir Jonathan Michael report last year. Where are we up to, really? What progress has been made in that year on the recommendations he made?
So quite a bit has moved on in terms of the healthcare transformation programme. Even during the COVID period, there was work underway. We have started now creating the setup of Manx Care, which is the most fundamental change that's going to happen in the department. The legislation is now in the branches. We've reached second reading stage in the House of Keys, and clauses stage will be coming in October, followed by third reading, and then on to Legislative Council. We've also gone out for advert in relation to the chair of Manx Care, and we'll be shortly going out to advert for the chief executive as well. So things are really progressing. There's also been work done on the ground across the various different areas in terms of integrated care and bringing things together. So there's a lot of movement been going on over the last few months.
You've mentioned about some of those specific roles that are going to be involved in the project. How's the recruitment process for those going so far?
So I can't say too much at this stage, but what I would say is we've been very encouraged by the applications received for the chair of Manx Care. The chief executive officer one is only in the process of going out now.
Because you're looking for quite specific and quite high-level qualities in these individuals.
We are. We've got a high expectation of the people who will be taking up the roles. They are very senior roles to have, and of course very important roles, because they will be giving the guidance towards delivery of services within the Manx Care model.
How do border restrictions affect recruitment?
So obviously there is an impact in terms of that, in terms of people physically attending for interview, but obviously we will look to utilise technology wherever possible, and of course CVs will be submitted in the normal way, but like I say, it may well be Zoom and various things that are used for the interviews rather than actual physical face-to-face.
So Jonathan Michael made 26 recommendations. How many of those have been acted upon or implemented a year on?
So all 26 are underway. It's not a case of you can just pick one recommendation off, implement it, move on to the next one, because as Sir Jonathan himself said in the report, all of the recommendations interlink. So we can't just pick one off and say, well, that's recommendation 1 done, let's move on to recommendation 2, because they all interlink across the 26. So all of them are progressing basically together, which will then deliver ultimately our transformed health service.
I suppose the elephant in the room really, has the COVID-19 pandemic slowed progress? Is that inevitable?
In some areas, yes, it is inevitable that it has slowed things down, but equally in some areas I think it's actually sped it up. So some of the things that we're talking about more use of technology in areas, Sir Jonathan spoke as well, not so much in the report but around the report, of 111 and the way of doing triage.
So some of these things have happened through
necessity. So some of these things
perhaps
have actually happened because of COVID.
Yeah.
So I think, as I've said in interviews before, there will be some good things that have come out of this, that we have spread along. We've sped along with basically consultancies and so on being done online.
The report that's before Tynwald this week says there will be huge change in the next 12 months. Can you give us a bit more detail about what specifically people are going to see changing in the next year?
Well, the absolute massive change is Manx Care will come into operation. Yeah. We are sticking to our timeline with Manx Care.
So that's April next year?
Start of the new financial year.
That's still on track?
Yes. The legislation is now in the branches and it will be through, with the plan for Royal Assent to be in place in February. We plan to have Manx Care up and operating in shadow format by the start of the year, so that way it can then lead into a full launch in April, and the new world of having the delivery split off from the policy.
And what does that mean for patients? What changes will they see?
It'll be much more patient-focused. It'll be a lot more delivery-focused. So the organisation of Manx Care will be purely around the delivery of services. That will be their pure focus, whereas the department and myself as Minister will be more policy-focused rather than having to worry about the operational implementation on the ground.
We're speaking just before the July sitting of Tynwald. Politicians then go into recess periods over the summer. What does that mean for the progress of this? Does that mean things get accelerated, or does that mean that less happens? Bit of
it
each.
means things carry on as normal, other than the fact that obviously the sittings suspend, everything else continues.
Yeah.
There's no great, not that there could be this year anyway, but there's no great 2-month holiday for people. Everything continues as normal, and the transformation programme will be continuing to work over the entire period.
Talks with the UK Care Quality Commission to bring in inspections across health and social care are on hold. When are they going to resume?
Well, they have resumed. Basically, we are talking to them. Obviously, the Care Quality Commission has had its own issues over COVID-19 and has been redeployed and focusing on various things, particularly within the nursing home aspect of the UK. So obviously, we've had to wait for them as well to get back to normal. But we are continuing to talk with them, and we are continuing to try and move it forward. I've said time after time, an independent regulator is a very important function within this.
And that's pretty pivotal to finding out how and if transformation's working.
It most certainly is, and also going forward, giving clear transparency to the service, where it can be investigated if things are going wrong, or if the regulator, be it the Care Quality Commission or someone else, because obviously CQC doesn't cover everything. It doesn't cover children and families, for instance. If they feel there's something wrong, a chance to investigate it, and it to be out there in the open, so transparency for the public.
Elsewhere, talks with the North West Air Ambulance Service over an emergency air bridge were unsuccessful. Are you able to tell us why?
I can't go into the details with that, but obviously we're disappointed that they weren't successful, but we will be continuing to work on the air bridge option.
So what does
to ensure
happen?
We can have it in place.
What does happen next? Are there other options?
There are other options, and we can look at other providers and the ability to be able to do it, but because the air bridge does form one of the recommendations of Sir Jonathan Michael's review, and we will continue to work to build that.
There are 12 transformation projects rated as green, amber or red. Green meaning they're on schedule, amber meaning they're delayed, red meaning they're completely on hold, basically. Have I got that right? In
For
principle?
the time being, yes, yeah.
Only one project so far is rated as partly green. What does that mean for people who are going to be reading this?
Well, for those who are used to the RAG ratings, red, amber, green ratings that you refer to in other walks of life, as projects develop, they start moving through the stages. So at the moment, obviously, there has been an impact from COVID-19. Transformation has continued, but not obviously at the level that it should have done. So that is why you've got at the moment an awful lot of amber. But also, as I say, a lot of the individual projects are linked to other projects. So unless that project starts moving. So what you will see is things slowly moving through the phases, where you will at the start have an awful lot that are within the amber rating before they can actually move into the green, because they're dependent on another project as well.
So is there an onus on the department to accelerate lots of this now?
I mean, obviously there will be an acceleration to try and move it forward and to keep it on track. Timing wise, we are sticking with the timings that we envisaged. Manx Care being up and running will obviously help with that as well in April next year. But we do need to accept that some parts of the transformation are going to be years down the line. That was laid out by Sir Jonathan in his report. We're under no illusions around that either. It's not a quick fix. It's not something that's just going to happen overnight. You're talking about fundamentally reordering the services.